Secret number 8, heart disease is reversible. Reverse heart disease, atherosclerosis, and calcification. And there has been a bit of an ugly conversation on social media, places like Twitter and Instagram. Heart disease is not reversible, and those old white-haired doctors were just wrong. Well, I do not believe that that is actually the case. It's easy to throw darts at data that's very hard to develop. But there's no new data that says heart disease is not reversible. There's just reanalysis of the techniques used, which I'm still very much a supporter that the disease is reversible. And I'll show you why. So let me take you through a little journey. It's always nice we have a little bit of time. This is a classic picture. And for the second time, I'm going to say Paul Dudley White of Harvard. The gentleman with the white mustache and the bald head in the middle of the picture was the chief of cardiology at Harvard. This is a picture in 1951 in Italy, right outside of Naples. And they're in a small little town that had no heart attacks in the last decade. These are actually good Italian doctors, no heart attacks. The gentleman to the left that has glasses on, not sunglasses, just reading glasses, and he seems to be holding, it looks like an iPad in his hand, but it's 1951, it's probably a notebook. That is Dr. ANCEL Keys of the University of Minnesota School of Preventive Medicine, and he organized a worldwide effort to identify what role does diet have in heart attacks and heart deaths, and he brought a team with him from all over the world, and they went to a town called Nicotera, Italy, and they started a study in 1958 that's still ongoing called the 7 Countries Study. Well, they started it in 1958 and it's still ongoing. So there's actually 25-year follow-up and even more. And what they found after very detailed analysis is countries, cities, and communities that ate foods rich in saturated fat had a much higher rate of dying of coronary heart disease, CHD. That's like heart attacks. So if you look at community E is Finland, North Karelia, Finland. They love their sausage and butter in North Karelia, but they suffered the highest heart attack rate in the Western world in 1968, 1969, 1970. And that's a bad deal. And if you go over there way to the left where it says T and U, those were places like Japan and Croatia where they had a diet naturally low in saturated fat. And they looked at everything else. They looked at total fat. They looked at sugar in the diet. They looked at refined and unrefined grains. All these things matter. But statistically, the food content that most correlated with dying of a heart attack was the content of saturated fat in the diet. This was other data from the 7 country study, Dr. Keys, Dr. Paul Dudley White, looking at your blood cholesterol level and your risk of dying. Now the country codes have been revealed. If you look way to the right, in Northern Europe, it was Finland, the average cholesterol was over 300, and they had the highest rates of dying in 25-year follow-up from heart attacks of anywhere in the study. Then you go way to the left, and you've got Serbia and you got Japan. You can see their total cholesterol on average was 125. I mean, some people were 80, 70, and 90, and some people were more, but they enjoyed much, much lower risk of dying of heart disease. Does this prove the point? No, it doesn't prove the point. These are association studies, but they are some of the most carefully done studies, and they were done before we had laptops and internet. Very, very hard research done very carefully. But the real test study that's so interesting is that community called Finland. They knew they had a heart attack problem in the region of Finland that was closest to Russia, the southeast corner called North Karelia. It's a southeast corner, but it's the North Karelia region of Finland. And they got a public health effort together with a young doctor named Pekka Puska. Pekka Puska now is a celebrated preventive doctor, retired. He's celebrated all over the world. But in 1970, he was a young man who said, let's see if we can stop heart attacks in Finland. Same study could be done right now in the United States. What if we put posters up to quit smoking, posters up to eat fruit and vegetables, and what if we take saturated fat down in the diet and put more beans and peas and lentils and legumes? And they did that fairly successfully. And as you can see in the red line, the heart attack rate in North Karelia, Finland, starting in the 1970s, started to drop. It dropped 85% in 5 years. So it was a huge success. What did the rest of the country want to do? They wanted to get involved in this. So the rest of the country followed the same public health, public education program, but it also involved working with food companies to make food choices lower in saturated fat. They actually stuffed the sausages with black beans, and slowly the public accepted the change. So if you look over to the right, all causes of death dropped by half. All heart causes of death dropped by 3/4. Heart attacks by 79% in the entire country. But the good news is things like cancer and dementia went down too, because saturated fat plays a role in many of these diseases. So amazing data that should never be forgotten. In France, they did the same thing, one of the most famous heart intervention studies. Men and women with coronary heart disease, all they did was say, one group, keep on eating what you're eating. One group, goodbye butter. We're going to give you a low saturated fat margin. And some of you are saying, my God, they gave them canola oil margin. How did they even survive the 4 years of the study? They survived. Canola oil margin beats the heck out of butter, because the rate of heart disease death just in 4 years fell by 2/3. That's more powerful than medication to reduce saturated fat in the diet. Very famous study. All right, quickly, we'll speed it up a little bit. An internal medicine doctor that doesn't get celebrated the way he should in Los Angeles observed his heart patients dying of heart disease. He gave them a menu. I want you to follow a low-fat, low-processed food diet. But he was doing this in 1949, 1950, and 1951, Lester Morrison. When he followed up in a randomized manner, not blinded, but randomized, the control group that kept eating Los Angeles food, they died like flies because there was very little therapy of heart disease, no bypass, no stents, no balloons, no defibrillators, and no pacemakers. But about 40% of the group was still alive at the end of 12 years if they followed the menu. What was the menu? This was all it was. Avoid cream soups, avoid liver and brains, avoid whole milk, avoid pancakes, waffles, and coffee, coffee cakes, often made with lard. Avoid the egg yolk, avoid the ice cream, avoid excessive oils, nuts, avocados, rich gravies. Ahead of his time, this is published in the American Heart Journal in 1951, and Dr. Morrison ended up writing several books about it, which I have. So he took 100 people 6 months after a heart attack, a low cholesterol, low fat diet or a control. They lost weight. The men dropped weight. We don't even see men anymore that weigh 166, but they dropped to 140 pounds, and women that dropped from 141 to 124. The cholesterol, there were no drug therapies. The cholesterol fell by 100 points. Very impactful to follow the Morrison diet. Well, who followed the Morrison diet other than this group that was studied? I left out Mr. Nathan Pritikin, visited Dr. Lester Morrison, studied his research, adopted the Morrison diet and exercise, and dropped his own cholesterol, then went on to change the world. But for sake of time, we're going to jump past the famous Mr. Nathan Pritikin. If any of you can see me, I still have lots of Pritikin books in my office. This wasn't written by Mr. Pritikin because he had passed on already, but I have his books to my right. But of course, in San Francisco, California, Dr. Dean Ornish had completed a medical school and an internal medicine residency and was a preventive doctor, and designed a program to systematically not just look at how many people live, but at actual coronary arteries. Can we influence actual coronary artery disease? Is this disease reversible? If we pack your diet full of vegetables, fruits, legumes, whole grains, we have you do some walking, have you do group sessions, stress reduction, quit smoking, and avoid high oil foods like meats, olives, avocados, excess nuts, high sugars, and all. And of course, in 1990, he published the famous lifestyle heart trial, but in 1998, he published a 5-year follow-up. Everybody in this study wasn't massive, but when you have exquisitely sensitive and accurate techniques to measure disease, you don't need 5,000 patients. You wouldn't need 5,000 patients to study the role of airbags and seatbelts and people with head-on collisions at 100 miles an hour. You'd need about 10. You guys don't wear that stuff. You guys wear that stuff and see what happens. So he designed a small but exquisitely accurate study. And what he had people do in the study was 3 times in 5 years, baseline 1 year and 5 years, they went into the hospital and they had a heart catheterization and a coronary angiogram, tubes up to the heart, dye injected, x-ray images. But much more important than that, the images were analyzed by automated computer quantified angiographic techniques called QCA. So this wasn't just some subjective eyeball. This was the state of the art then and even now. And they showed that the 2 groups, a control group that did not have their lifestyle intervened upon and a treatment group that did have their lifestyle intervened upon, had very different amounts of plaque at the end of 5 years. The control group got worse and worse and worse, from 41% to 52% average amount of blockage. And the intervention group, the lifestyle group, the Ornish group, less and less blockage over time. And all you need is your arteries to slowly improve, and you will reduce your risk, feel better, and be on the road to success. This is indeed, to be fair, a picture from the famous Cleveland Clinic doctor, Dr. Caldwell Esselstyn. There are pictures of angiograms from Dr. Ornish's, but this a general surgeon at the Cleveland Clinic who dramatically changed his diet under Dr. Esselstyn's advice over the course of 3 years, had a baseline and a follow-up angiogram, and his arteries were shown to have dramatically reversed the disease. It happens. We see it. And it should have been game over. It should have been in 1990 and 1998 that we shrunk our bypass programs and we shrunk our stent programs and we shrunk our balloon angioplasty programs and we had enormous preventive cardiology programs. But that's not what the money did, and that's not what really dictated the course of the last 20 to 30 years. Although 20 years later from the original Ornish publication and probably 25 to 30 years after the original Pritikin publication, our own government in the United States, Medicare, Medicaid, and now most other insurers agreed to pay for people who have had a recent heart attack, stent, bypass, anginal chest pain to learn how to change their lifestyle, as was researched by Mr. Pritikin, as was researched by Dr. Dean Ornish. And it still exists. In the state of Michigan, until about a year and a half ago, we had 1 program, sadly, in Ann Arbor, Michigan, only one that adopted this strategy. It was a Pritikin program. Now we have about 4 or 5 in the state of Michigan. Hallelujah. And we can get people into them, although cardiac rehab has been greatly affected by COVID, but the programs are back open. In my own clinic, this is an example of those carotid intimal medial thickness ultrasounds that are read with digital technology in an objective way. And this is just one example of hundreds I have in my clinic of people who had a baseline and then a follow-up ultrasound of the carotids. And we show that the plaques are shrinking. And I don't read these. These are read in Utah on a computerized quantitative system. But if you look at the right carotid, there was a plaque there that was 3.3 millimeters, and now it's shrunk in half. It's 1.5 millimeters. If you look at the left carotid, even more dramatic, in the course of 1 year, a 4.9 millimeter big, ugly plaque shrunk to 1.5 millimeters, plus the actual thickness of the wall of the carotid artery dropped from 0.58 to 0.54. Very dramatic. And I can reach over and show you 25 more that are sitting on my printer that we've seen in the last month or two. You can demonstrate plaque reversal, and this involves no radiation or anything invasive, which is what's lovely about the technique. We see people whose arteries get dramatically younger. This is a 61-year-old man that was studied twice about a year apart, and he went from what's called the 70th percentile to the 41st percentile. And originally it said you're 67 with arteries like a 75-year-old. And then a year later it said you're 67 with arteries like a 61-year-old, because the fatty portion of plaques can go away. The fatty, dangerous portion can resorb back into the body. If you don't put obstructions with lifestyle to the body's physiology, it can heal itself. Such an important message. So the yellow line here is the key. You're born clean as a baby in terms of your arteries, and you die of heart disease, stroke, erectile dysfunction, impotence, leg blockage called peripheral arterial disease. But you can interrupt that, and you can take that yellow line and make it start to go. It's going to take time. If you're 57 years old and you're having advanced cardiovascular issues, you're not going to get better in 57 minutes. It's going to take some time, but it can happen within 3 to 4 weeks. We can start to document some actual improvements clinically and a little longer with imaging.